I'm here in my office, Vulvar Vestibulitis International, and I'm with one of my clients, Alma.
Hello.
She had a terrible condition called Vulvodynia, and she had had symptoms for 17 years, and I want you to hear her story about what it was like and how she found me and how it turned out for her.
I was going through a lot of going to the doctors all the time, and they said I either had a bacterial infection or a yeast infection, and it was like that for years. It was for a really long time.
The reason is the doctors really don't have any other choices than the 4 types of vaginitis that have been looked at for over 150 years. And it's really easy to rule out yeast, and it's easy to rule out atrophic vaginitis, easy to rule out trichomonas. So if they don't have any of those 3, then they just call it BV. But it's almost never BV that's causing problems with this. It's one of a number of altered vaginal microflora patterns that causes this problem. So patients like her go in and the doctors see them and they look at the wet preps and they just give them antibiotics and antifungals and let them go, and often they feel a little better for a week or 2.
Right.
Then symptoms relapse.
Exactly. It got so bad that started to get desperate. I went and I saw a urologist. I saw multiple gynecologists, other specialists. They wanted to give me a full hysterectomy. They said I had interstitial cystitis. It's just all kinds of different problems that they said that I had that would get rid of the pain.
A lot of women are told they have interstitial cystitis because vulvodynia will mimic those symptoms. The tube that comes from the bladder, the urethra that starts in the bladder and comes out to the vagina, opens in the vestibule. The vestibule is an area in the vagina. It's about a 1/2 inch wide and goes all the way around the opening of the vagina, and it's made out of endoderm, where it's flanked on both sides by tough ectoderm. So what happens in patients that get vulvodynia is they get these altered vaginal flora patterns, and it causes an irritant. Their vaginal secretions go from a neutral to a caustic, and it comes down, and it doesn't hurt the tough ectoderm of the vagina, but when it hits that endoderm down at the opening of the vagina, it sensitizes that, and that's where the tube from the bladder opens, so it irritates that, and they get frequency, urgency, and burning with urination, and commonly they're told they have IC, but they don't.
Exactly.
It's part of the vulvodynia spectrum.
So I just, hearing all of these different things that I had to get done, it just didn't feel right. And one night I just started looking up online of my symptoms, and I came across Dr. Fowler, and I read all of the testimonials that he had, and looked up all the reviews and everything, and it was nothing but the best. So I called and made an appointment, and it was the best decision I ever made, because it worked. It got rid of everything. It took time, but it was well worth it. It worked. So.
How would you describe your life before we put you on an FGI protocol? What was it doing to you?
I couldn't wear certain clothing. It irritated. I couldn't, it's like you can't function because you're just so focused on the pain. And I have 3 children, small to big, and it was hard. It was really difficult to, spend time with them. I just wanted to lay down in bed or stay in the shower, because that felt like it was the only relief that I got from the pain. So.
Imagine that going on for 17 years. Then how joyed were you when you recovered fully on our protocol? What did you think?
I just was so shocked. I still think about it. It's emotional. It's because you just kind of wake up one day and it's not there, and you keep thinking in the back of your mind, is it going to come back right now? Is it going to creep up? And it didn't. So it's good.
So you've heard of one testimony of one woman that has vulvodynia here today, and I hope this gives you hope to look us up here at Vulvodynia International.